My name's Tina Pizzavento. I'm a Continence and Pelvic Health Physiotherapist. I'm just going to have a little bit of chat about pelvic floor health for women over 50 years old. Just a little statistic just to keep in mind that 1 in 4 people over the age of 15 actually have bladder and bowel issues. Leakage isn't normal and most can be cured or at least managed well. So today we'll talk about pelvic floor exercises. So in regards to women over the age of 50, menopause has quite a large contributing factor in regards to bladder and bowel issues, mainly because the pelvic floor muscles do weaken over time if they're not exercised regularly. There are vaginal changes and dryness with hormonal changes. The bladder can become less elastic too, so it becomes stiffer. There's sometimes history of pelvic surgery like hysterectomies, etc. There may also be other health issues like diabetes where nerves and that can be damaged, so there's less sensation and weakening of the pelvic floor muscles. But we know that if a muscle can contract, we can strengthen those muscles and help some of those symptoms. So in regards to the pelvic floor muscles, we need to be able to locate them properly. So I've got a pelvis just here. So this is basically the pelvis sits slightly tilted forward. That little crest there is what you can feel at the top of your hips on either side. The two halves of the pelvis join at what we call the pubic symphysis, or the pubic bone at the front. And then if you can imagine, the spine comes down to the sacrum, or the lower part of the lower back, or down to the coccyx or the tailbone. Now inside the pelvis, we have our pelvic organs. So the bladder, the uterus, if you still have a uterus, and then the bowel and the rectum and the anus. Now, the floor of the pelvis is the pelvic floor muscles. They're made up of 2 layers of muscles. So you have an outer layer, which is made of a ring of muscles around the bladder pipe and the vagina, and then a ring of muscles around the anus. Then there's the deeper pelvic floor muscles, which is the floor of the pelvis. Now, they have slightly different actions. So the outer layer has a squeezing, basically, contraction, and at the front and at the back. And the deeper layer has a lifting action. So if we want to have a little practice of that exercise, you can sit in a chair, preferably, well, it can be sitting, but you can also do it in lying, but sometimes in sitting, you might just feel the activation of the muscle a little bit better. So you roll your hips forward to sit forward. In that position, you should be able to feel where the actual pelvic floor muscles are. Imagine those outer muscles first, so the little circular muscle at the front and the circular muscle at the back, and think about trying to squeeze that muscle. So just closing off those pipes and then relaxing the muscle. Next, we want to think about that deeper muscle as well. So we're going to do a squeeze and then a lift of the muscle. So let's have a little try that now. So we squeeze and we lift the pelvic floor, hold it for a few moments, keep breathing in a relaxed manner, so don't hold your breath, and then gently drop that pelvic floor and let it relax. Now, when you do the contraction or the tightening of the pelvic floor muscle, we want to make sure that we're not using our big bottom muscles or the buttocks, your thigh muscles. You shouldn't be holding your breath. Your shoulders should be nice and relaxed, and you shouldn't be tensioning any of the muscles above your belly button. So if we try that again, and we're going to hold that muscle for a little bit longer, and I'll count. So gently, hips rolled forward, breathing in a relaxed manner. Gently squeeze, lift, hold the muscle, keep breathing. 1, 2, 3, 4, 5, and let the muscle drop and let go. Just as important as contracting that muscle, so obviously squeezing and lifting, we must also make sure we drop and let the muscle go and let it rest. A muscle kind of half contracted will get fatigued, and that's no good. That'll cause other issues. So you must relax, let go of the muscle, and then contract it again afterwards. Now, how long we hold a muscle just really depends on the individual. Some individuals may be able to hold it for 3 seconds. Another person may hold it for 8 seconds. The idea is you do your maximum hold, and depending on what you're able to do. How many repetitions? That can vary from 4 to 12 repetitions. But again, you do the amount of repetitions that you're able to do in a row, and making sure you have a rest in between each contraction. Right? So the idea is to set up an exercise program that is challenging yourself, that you are actually working the muscle, and then to aim to do the exercises 2 to 3 times a day. Now, we're doing them in sitting at the moment, but there's other positions you might find a little bit easier to initially activate the muscle. So you might do it in lying or lying on your side with a pillow between your knees, or sometimes even in standing, which will challenge the muscle a little bit more. But aiming definitely to do it 2 to 3 times a day. Now, as you get more comfortable with that exercise, you increase your length of hold of the actual contraction or the tightening of the muscle so that it's improving each time. So for a muscle to strengthen, you need to keep challenging the muscle as time goes by, and you should notice improvement. Improvement can be noticed maybe even in a month's time, but it will continue to strengthen over more than 6 months. The other really important thing you need to do is to use your muscle or pelvic floor muscle functionally. So for instance, if you are doing any form of exercise, if you're coughing, sneezing, laughing, blowing your nose, lifting anything around at home, squeeze up and contract that pelvic floor muscle to hold that little pipe closed so that you don't leak anything. So it's just an action of squeezing and lifting every time you do those actions I mentioned before. And that needs to be habit. Sometimes the muscle doesn't come in automatically and you need to practice it so that the brain tells the muscle that it needs to be an automatic reaction. The other thing is general exercising is important. So obviously we could practice exercising our pelvic floor, but other general exercise with it is important too. We need to maintain weight control as well, because an increase in waist circumference will put more pressure on the bladder. So obviously just general exercise is important. Maintaining or preventing constipation, so straining day after day is also an issue. So good, basically healthy diet, lots of adequate fluids, fruit and vegetables, so that there's no straining and no problems with your bowels as well. So if you have any difficulty isolating that pelvic floor muscle, that's when you may need to seek further help, or if you do have any leakage or urgency, bladder or bowel that doesn't seem to be improving, or even a vaginal bulge or heaviness in the pelvis, it's probably then when it's worth seeking further attention. So there's a few places that you can kind of access extra information. The Continence Foundation of Australia is a website that has lots of resources. Lots of brochures to read, lots of information. They also have a helpline that you can contact. And as well, you can contact or see your GP, and your GP can refer you to one of the specialist pelvic health physiotherapists in Shepparton or in your local area, or even Golden Valley Health Continence Clinic, or the Women's Health Physiotherapist at Golden Valley Health. But start off trying to practice the pelvic floor exercises yourself. Progress the exercises. If you're still not sure, make contact with one of those resources.